Thousands of people fall each year, resulting in harm, distress, and in some cases, death. While most falls happen in the community, some occur while people are in hospital receiving treatment for other things. Many of these falls are preventable.
It's clear here. Are you all right?
When a patient falls, it just breaks your heart.
And the nurses always feel like they perhaps have failed.
We take people out of their normal environment, put them into a strange environment. We're giving them medications and different things that could increase their risk of falls.
Mum is 93 and she had a fall. She'd actually fallen in the bathroom within her hospital room, lost her balance, fell back and smacked her head on the back of the wall.
Somebody has to take responsibility. So what we've done is made falls everybody's business.
It is the responsibility of all the people who are looking after, that older person who comes into the hospital, is to do a falls risk assessment at the time of admission.
There's no magic bullet for falls. There's not one health professional that holds the key. It's something that we all have a role in preventing, and we're all as equally as important as anyone else.
Keep your eyes at eye level and keep breathing into the tummy.
The aim is to get as many older people as possible to join to prevent falls, because falls are the most common cause of injury for older people.
Remember, keep that back leg parallel to the floor. Jack, back leg parallel to the floor. That's better.
A few years ago, I actually fell getting out of the Fortune Theatre, and I rolled down the steps and hit the proscenium. From there, I'd lost total confidence in getting up and down steps and stairs. And I went down to my doctor, and she recommended exercise. And I got a pamphlet on this particular strength and balance program, and it has made a tremendous difference.
When you get older, you need to focus on particular muscles, which the classes do, to strengthen your legs and get that balance really sorted out.
I shuffle around my slippers and I think, oh, I'm forgetting to lift my feet. I'd had a few falls in the last few years, and that was the reason I came, and I think it improves your balance.
I no longer use my walking stick, but the class has been of tremendous help, and also socially.
And you meet other people in the same sort of situation as yourself.
Yeah, that's a good thing.
And you think to yourself, well, they do it, so, why can't I?
Once they've started coming, most of them don't stop. They just keep coming.
I don't come to the classes. If I have a break over the holidays, my general condition goes back quite rapidly.
And you're keeping your back straight, which is what we're meant to do.
I was going to Tai Chi, but I broke my femur, so that was the finish of Tai Chi.
I will stay in my home as long as possible, so I guess there are certain things I've got to do to be able to do that.
And it's 402 for 7.
Thousands of people fall each year, resulting in harm, distress, and in some cases, death.
Help! Help!
A significant number of falls occur in rest homes and hospitals, but most happen in the community and around the home. Many of these falls are preventable.
He was having, about 15 to 20 falls a week. He would just walk and fall.
Around 40 people a week were attending our emergency department. People 75 years and over who had had a fall in the community, and we're admitting between 60 and 70% of those people into hospital care.
Yes, the last place I want to end up is in hospital. And also, I don't want to go into a home.
So we've invested $1 million over a 2-year period on a community falls prevention strategy. We have the pharmacist, the practice nurse, the general practitioner, the local physio, who work together around the overall care of that person in their own home.
So this one's the nosy neighbour one. Les, up onto your tiptoes.
And often when we go to see a patient in their home, we'll find a whole raft of issues that their GP may not know about because they've never seen the home environment.
We see a patient, we're 15 minutes with that patient, and yet we can now bring in these wonderful services like medication management, like falls prevention, which is involving, pharmacy, OT, physio, all that allied health input. They all report back to us. It's a great collaboration, really.
See how easy it would be to catch your foot underneath that, especially, if you're getting up in the night to rushing to get to the toilet.
The people who I've been connected with have made such a difference to my life.
Keeping your body up nice and tall. That's the one. Very good.
Can't go much taller.
In the last 12 months since we've started this initiative, we've had a 7% reduction in the number of people admitted to hospital having had a fall in the community.
And that's a pretty exciting place to be in.
I would say if he hadn't have done those exercises, he mightn't have been able to stay home.
In the next 10 years, the population of people over 65 in Canterbury will double. Preventative strategies are the way to go.
Down again, for 5, 4, 3, 2, and 1.
Well, falls prevention plays a big part of somebody's care in a facility such as ours.
I like to be independent. I like to be free. And I like to walk.
Our focus here is about ensuring people have an excellent quality of life and ensuring that they are as safe as they can be, but still able to participate in all the things that they want to do.
Okay, Maura, we're going to walk you down to the lounge, okay?
My feelings if Mum had a fall would be that she would get a broken bone and she would lose her ability to be self-reliant and lose that confidence. So it's important that they're kept to a point that they can be confident and still walk around and be active.
Ready, steady, stand. That's better.
Have you ever had any falls? Once we find out whether they're low, medium or high risk, we can also look at what interventions would then be appropriate. So we have hip protectors, non-slip socks, maybe a sensor alarm, and some things might be trialled just for a week and then removed, or otherwise they might be tried as successful and be ongoing.
For up and down.
Since I've been here, I've never had a fall.
I like to walk further than Jeffrey lets me go sometimes.
It's really important to get a balance between the fact that you are keeping them safe, but they still are doing what they want to be doing, those daily routines. Yeah, there's no doubt that being able to prevent falls is a huge part of job satisfaction, an amazing feeling, and yeah.